Hello and welcome to the latest video in the Medical Association of Atlanta's webinar series. Today we are discussing monkeypox. My name is Dr. Anna Skold. I am a board member of the Medical Association of Atlanta. I am also an internal medicine and palliative care physician. And I'm here today with my fellow Medical Association of Atlanta board member, Dr. Jayne Morgan. Dr. Morgan, can you provide some information on your background and how you came into your current role?
Thank you so much, Dr. Skold, and it's always a pleasure to be here. I am Dr. Jayne Morgan. I am actually a cardiologist by training, but am the executive director of the COVID task force for the Piedmont healthcare system right here in the state of Georgia. And so obviously this has been quite a long pandemic, and we have monkeypox encroaching here as we are hoping to get towards the end. And so hopefully this will be a very vibrant discussion. By background, I actually not only practiced medicine and cardiology for several years, but I spent quite a bit of time in industry at both Solvay Pharmaceuticals and Abbott in their research and development divisions, as well as medical affairs and business development. And so I understand very intricately the drug vaccine development process. So earlier, when we began talking about messenger RNA vaccines, I was able to explain the development of these vaccines very clearly, as well as the timeline.
Thank you, Dr. Morgan. Yes, you've done a great job of explaining, especially so people can really understand very difficult concepts in very basic, straightforward ways. So we're thankful that you're with us today, and you're going to do that for monkeypox. So let's start. So what is monkeypox? Let's start at the very basic.
So monkeypox is in this family of viruses called the orthopox family of viruses. And you may have some familiarity with it because smallpox is in that family, cowpox. These may be diseases that you have heard of, although they are pretty much non-existent here in the United States. One family that it's not a member of is chickenpox, with which we are much more familiar here in the United States. And I get that question frequently. Isn't this similar to chickenpox? And actually, chickenpox is in the herpes family of viruses, so a completely different family of viruses. And so here we have monkeypox, which really originated in Central and West Africa. We have it here on our shores. We see it in Europe. Indeed, we see it in many, many places where we have never seen it proliferate and thrive before. And so this has been somewhat of a warning to us and of concern as we continue to battle it and make sure we're moving forward in the right direction with lessons learned from COVID.
Right? Lots of lessons learned. One of the things that I've been asked is monkeypox a new virus, just like COVID? And I believe it's been around for a little bit of time. Is that correct?
Absolutely. So monkeypox is not new, similar to COVID. COVID also was not new. We just hadn't really heard of it. Monkeypox is even older than that. And actually, in some areas of Africa, it is endemic and people are very familiar with it. Unfortunately, monkeypox is actually a misnomer. It actually doesn't arise from monkeys. It arises from lower animals in our zoologic system, generally rats and mice. We can see it in prairie dogs. And it was first recognized in caged monkeys in Africa and then named monkeypox, and that name has just stuck. But it's actually, the monkeys are actually not the reservoir. They've just been the unlucky recipients of the name of this virus, but it actually comes from somewhere else. And there are actually different strains of the monkeypox virus as well. We are lucky in that we are experiencing one of the less lethal strains of monkeypox, but there are different variants that can give you a mortality rate, meaning a death rate of 10% or more. We have not experienced that here with this particular variant of monkeypox that we have currently.
That's good to know. So how do you get it? How do you get monkeypox from someone?
You know, such a great question. Monkeypox is spread by direct and prolonged skin-to-skin contact. Your skin actually needs to not only come in contact with someone else's, but probably rub and transfer that virus and lesions to your skin. And so we absolutely know that there are many types of activities that you can come into close contact. And so currently we see that sexual activity is the #1 means of transmission that we're seeing here in the United States and in Europe, but it is not the only means of transmission. And that is why it is not currently listed as a sexually transmitted disease. It is sexually transmissible. That's one of the ways that you can get it, but it is not sexually transmitted. You get it by prolonged skin-to-skin contact. And so therefore, we want to be concerned in places where you may have congregate settings, meaning close settings where people are in close contact for long periods of time and may be in contact with each other, like daycare centers where children bump and rub and touch and bite and lick, these kinds of things. So we think about congregate settings like that. Daycare centers, nursing homes, including prisons as well as another congregate setting. But we can think of all types, including our school system.
Very good to know. So how can you prevent monkeypox?
And so one of the ways to prevent monkeypox is obviously to try not to come in contact with someone who has it. Now, you may or may not know it, but these lesions are generally pretty evident. Now, someone can certainly hide them as we move into fall and winter and wear long sleeves if they have them on their arms or on their legs and wear long pants. Hopefully, people will not be that negligent and intentionally be out in public with them. But again, if those lesions are covered, you should not be able to get it by touching the clothing that is covering their lesions. The lesions, though, however, generally will appear more frequently on the face, on the hands, on the feet, and also in the genitalia. The other way that we see very commonly, we see it in the group of men having sex with men and also bisexual men. And so again, there's this connotation that it's sexually transmitted. But the fact of the matter is sexual activity is just one of the ways, and also multiple sexual partners and anonymous sexual partners. And so if you have multiple sexual partners in an area of the country that has a high incidence of monkeypox, then you are at increased risk. So you absolutely want to know your sexual partners and limit the number of sexual partners, because what are we trying to do? We're trying to decrease the amount of skin-to-skin contact that you would have. And certainly sexual activity is one of the ways that we see that.
Very helpful. So is there a treatment if someone were to get monkeypox? What would the treatment look like?
And so while there's no specific treatment for monkeypox right now, we ask you to isolate. And that isolation is actually for a prolonged period of time, for 2 to 4 weeks. This is not COVID, where you are isolating for 5 to 10 days. You must isolate until the scabs, these pustules on your hands and on your feet and on your face, wherever they are on your body and your genitalia, you must isolate until those pustules scab over, fall off, and new skin replaces it. Then wow, you are no longer infectious. That is a long period of time that can be up to 2 to 4 weeks. Now, what can you do if you are incredibly uncomfortable and you are interested in some intervention? And monkeypox can be very uncomfortable. It can be very painful, and it can be very itchy, which is another form of torture.
Yeah.
So what can you do? So we have the Jynneos vaccines, right? We have vaccines available, ACAM 2000 and Jynneos vaccines. Let me just talk about Jynneos for a second. The Jynneos vaccine, while we prefer that you use it for prevention, if you've been exposed to monkeypox and get the vaccine within the first 4 days, you can prevent infection of monkeypox. If you've been exposed and it's between days 4 and 14, you can still get the vaccine. It will not prevent infection, but can certainly mitigate your symptoms. In other words, make your symptoms more tolerable. The other antiviral agent to think about that is not specific to monkeypox, that was developed for smallpox, is something that we call T-pox, T-Y-P-O-X-X, and it is an antiviral agent. You would need to get it from your physician in conjunction with consultation with the CDC. And you certainly can use that as well as a prescription therapy to help you control your symptoms. Again, not a cure, but able to help you control your symptoms and be as comfortable as possible while you're isolating.
Good to know, so that people can ask for help as soon as they might have had contact and can try to prevent a bad outbreak.
That's absolutely true. And to prevent, in preventing a bad outbreak, right, you decrease your risk of spreading it to others if you have fewer and fewer lesions on your skin.
So what should someone do if they're exposed to someone with monkeypox and they're not quite sure if they're going to get it or not? What's the first step?
So if you're exposed, absolutely contact your physician, make certain that they are aware of it, and make certain that you get tested. The earlier that you are tested, the better, such that you can have good information as to how you should move forward with conducting your life responsibly in lieu of public health. How are you going to conduct your life responsibly and also think of your fellow man or fellow woman at the same time? So number one, contact your physician and then be prepared to isolate even while you're awaiting those test results.
And what are the symptoms of monkeypox? You started to talk about the rash, but maybe talk us through what are the early symptoms and then how things move along.
So early symptoms, so virus can be similar to other viruses, right? We're familiar with the flu, influenza virus. We now, unfortunately, have become familiar with COVID. So what are we talking about? Fever, chills, night sweats, some muscle aches and pains, which can be confused as well with COVID, can be confused with flu, can be confused sometimes with your really bad sinus infections that are coming on. But right. The fact of the matter is it's a virus and you have these viral symptoms, this viral syndrome. So think about that. If you're in a high risk group, you live in an area with a high percentage of monkeypox, you have been at an event where maybe there was skin to skin contact. A lot of these parties sometimes, especially in the group of men having sex with men, involve your shirts being off. You have to think about that and say, you know, let me add 1 and 1 and 1 and 1. And am I getting 4? Am I getting 7? And then think about what is the probability that you may have come in contact with monkeypox. Make certain that you contact your physician, that you get tested, and then isolate yourself while you wait on those results.
And how is monkeypox diagnosed? You talked about a test, so let's talk about the test.
So the test is a really good scraping sample of your lesion, the actual lesions. And these lesions are teeming with thousands of viral particles. So the lesion may actually even be broken a little bit during this testing process. But the testing is not something that can be done by telemedicine. There are no home tests and there is no telemedicine test that we can give you. So you must show up in person for this test, unlike the home COVID test. And I want to be clear about this, and I'm taking a little bit of an aside. The home COVID test cannot be used to test for monkeypox. You can only use the COVID test for COVID. Monkeypox is only diagnosed by testing inside of an official laboratory at the Department of Public Health or your physician's office. The COVID tests do not give you information on your monkeypox status.
Thank you. Good for us to know that specific tests are used for specific disease processes and they don't really work on the other one. So always good to mention that. Mm-hmm. So what
You
should
know, it's
somebody,
easily confusable. You can see how
it
people
is,
think that, oh, this is the monkeypox. Oh, I've got those tests. I'll just
right,
use the test that I have, because there's so much misinformation and the information is coming so quickly and things are changing and it's all confusing. And so, you know, we could absolutely understand why you would say, oh, I tested negative for monkeypox. And not, you know, the doctor needs to ask the follow-up question, well, where did you test? And it turns
right.
out you tested at home with your COVID test.
Yeah, no, I
So,
completely agree. There's so much information out there. It's confusing. So it's good to just mention that. Um, so can the smallpox vaccine help to protect somebody from monkeypox?
oh my gosh, that is such a great question, Dr. Skold. The answer to that is yes. If you have had the smallpox vaccine, you may have, I would say probably have, the data showing 85% protection against monkeypox. Now, here's the caveat. We stopped giving the smallpox vaccine in 1972.
Right.
So it's really only applicable to those who were born before 1972, with the
Right.
exception of the military. So
Mm-hmm.
if you've been in the military and you got a bunch of shots, you had no idea what they are, you were just in boot camp, they gave you a bunch of shots. If it was before 1991, it was the smallpox shot. And so between 1972 and 1991, if you were in the military, you also received that smallpox vaccine and have an 85% protection against monkeypox. Good for you.
That's great to know. That's quite a few people actually that have 85% protection.
Mm-hmm.
So you mentioned this before, but I think it's worth mentioning again. Can the chickenpox or shingles vaccine help to protect against monkeypox?
You know, a good question, because you brought up shingles, and we do get shingles vaccines, especially for those ages 60 and older, as well as chickenpox vaccines. The varicella is called varicella, maybe that's a word that you know, vaccines. And so you may think, you know, this all sounds the same to me, right? Chickenpox, smallpox, monkeypox. I think I'm set. I'm good. I got immunized. But the chickenpox vaccine, even though it's called pox, is in a different family of viruses. The chickenpox and shingles disease are in the same family of this herpes family of viruses. They are not in the orthopox family of viruses where monkeypox lives. And so therefore, even getting your shingles vaccine, I've had people say, I got my Shingrix, you know, vaccine. They turned 60 and they got their Shingrix vaccine and they had chickenpox when they were smaller, or they got the vaccine depending on what their age demographic is. But that does not confer, unfortunately, protection against monkeypox. But please make sure that you get that vaccine, because it does give you protection against chickenpox. And we absolutely want everybody to get their vaccine so you can keep yourself safe and we can keep society safe. And shingles is a very, very painful disease if you were to get it and you were to suffer from it. And so we want to make certain that you're protected as well, to decrease the amount of suffering, days away from work, and just general discomfort. So we want you to get all vaccines. The other thing that I will say while I'm adding this is that you can get your shingles and chickenpox vaccine with the monkeypox vaccine. So if you are there for the monkeypox, you can get shingles along with it. The same for COVID, you can get shingles and vaccine. This is an aside. You cannot get COVID and monkeypox vaccines at the same time. And I shouldn't say you should not. You should not. There is a caveat to that. The reason for that is that they both can mildly increase the risk of myocarditis, this inflammation of the heart in young men, very mild and very rare and uncommon, but they both do have that slight risk. However, if you are diagnosed with monkeypox and for whatever reason you just got your COVID vaccine, your doctor will probably say it is okay to move forward with the monkeypox, or if you are in the high risk group for monkeypox and high risk behaviors currently, and you just got your COVID vaccine, then you probably will be approved to get them both. So it's not absolute, but it's just something, if you're able to space them, you should. But in many cases, depending on your risk factors and exposures, you probably should not. So always talk with your doctor.
So just to clarify, so it's okay to get the flu shot, the shingles shot, the chickenpox shot, and get those with the monkeypox shot. The only shot that they're recommending, but not absolute, that you separate by 4 weeks is the COVID and the monkeypox because of that rare incident, especially in young men, of some inflammation of the heart. Is that correct?
Absolutely correct. That is absolutely correct. Yes.
Okay. And flu is already getting busy in
busy.
Georgia,
And
so
we want you to get your vaccines. And we're talking about monkeypox, but I've got to throw in there, get all of your vaccines. And if you are not up to date or you skipped some for whatever reason, this is a great time to get caught up on all of your vaccines, including the bivalent COVID booster.
excellent. So is monkeypox deadly?
So monkeypox, this variant that we have now, is really not deadly. It's very uncomfortable. It's unsightly. You probably don't want to sit for a family photograph when you have it. You may not want your friends to see you, but it is not deadly. There are other variants, specifically one that we don't have here in the United States, and hopefully we will not have it, that does have a 10% mortality risk. That is not the variant that we have here currently. We have some states with higher percentages of monkeypox than others. Florida and Georgia, where we are, happen to be two of those states with high percentage of monkeypox. But again, this particular variant is not lethal. It doesn't mean that you should be very cavalier and go out and be unconcerned because it's not going to kill you. The fact of the matter is, just as we've learned with COVID, mutations can occur. The viruses are not consulting us on when they're going to mutate and create a new variant. So let's not have reckless behavior and continue the life cycle of these viruses. Make certain that you isolate if you are positive monkeypox, but prevention is what we really want. So make certain that you understand how to keep yourself from getting monkeypox in the first place, and make certain that you tell your friends as well.
Very good. So who is primarily being affected by monkeypox right now?
And so primarily we see the group of men having sex with men and bisexual men who are primarily affected by monkeypox. But this doesn't mean that this is the only group. This is just the entree that the virus has used to enter into the human population, very similar to the trajectory of the HIV virus and how it first started. Because of different maybe habits and living situations and social situations, the virus can find different groups where it can easily or more easily get a foothold. But from there, it can spread to others. This is not a disease only of men having sex with men. This is where it is starting, but it is spread by skin to skin contact. Skin is the largest organ we have on our bodies and in our bodies, and all of us Homo sapiens have skin. So this is spread by skin to skin contact. Sexual activity is just one of the ways. Homosexual activity is just one of the ways. This is how the virus is getting started, but it certainly has a propensity to go elsewhere within our human population.
And you said this already, but I think it's a good thing to repeat. Can other people besides men who have sex with men get monkeypox?
Absolutely. Anyone can get monkeypox. Elderly, children, middle-aged, men, women, binary, everybody can get monkeypox. It is spread by skin, naked skin to skin contact. When I say naked, I don't mean your body has to be naked, but I mean the skin actually has to touch more skin. It's not your skin touching the sleeve of someone's jacket. It's skin touching skin.
You mentioned preschool students. I'm just thinking high school contact sports and things like that must be high risk as well if this were spread in the community. Wrestling, football, those types of sports where it's contact sport.
Absolutely. Absolutely. That is such a good point. You know, again, we talk about these congregate settings where people are for whatever reason for prolonged periods of time, and schools in both the academic and sports settings are absolutely congregate settings, and where you can have contact. And certainly in sports, you can have contact. And something else to think about is that this particular virus is also spread by respiratory droplets, not aerosol, like COVID, where you have, you know, thousands of particles that are suspended in the air. And so theoretically, if someone is in a room with COVID and they exit the room, someone else could walk into the room, even though that person is gone, and breathe in those particles because they're suspended in the air, sort of a spray, a trajectory. That's not monkeypox. Monkeypox is spread by respiratory droplets, which really are heavy droplets that don't come far from the mouth before they drop to the floor. However, if you are close to someone, like hugging or kissing or any type of other type of intimate contact, including, think about this, swaddling your child, changing their diapers, any place where you are in close contact, feeding a baby, those respiratory droplets could easily infect others. And so public health measures that we have learned for COVID also are effective for monkeypox: wearing a mask, keeping your hands clean, which is the primary tool that humans use for skin-to-skin contact. So keep your hands cleaned, and what? Practice physical distancing from people. Just as we learned in COVID, so many lessons in COVID, it's also very practical to prevent the spread of monkeypox as well.
Lots of practical lessons. We mentioned this as well, but I think it's also good to say, can children get monkeypox?
Absolutely. And let's reiterate that anyone can get monkeypox. And I want to be clear because, you know, in many aspects of science, as lessons have evolved, we've learned. And we made a lot of missteps in COVID. We made a lot of missteps in HIV as well. One of those missteps was that early on we stigmatized HIV as a gay disease. And that for whatever reason, it was in the community because of their behaviors and because of their sexual preferences. And it really stymied and delayed serious research to get on top of it. And so I want to be clear that monkeypox, like HIV, can be spread. Now, HIV is spread differently, but I just want to say, like HIV, it is not a disease of only gay people, of only homosexual people, of only the LGBTQ community, of only men having sex with men. This is where it is primarily currently, but any person can get monkeypox. That's anyone from grandma to baby, to your uncle, to your hairdresser, your teacher, your football coach. Anybody can get monkeypox.
So if someone is infected with monkeypox, how long before they actually notice symptoms or start to feel ill?
You know, you may notice symptoms, if you're lucky, in as early as 5 days. It could be as long as 14 days, but generally the symptoms can start as early as 5 days.
So a little bit under a week to about 2 weeks, it sounds like.
It can be, that's right. So it generally is not instantaneous, right? So as soon as you've touched someone with monkeypox, you don't just suddenly break out in lesions and develop a fever or drop to the floor. So none of that happens. But you may start to develop some of those early, what we call prodromal symptoms: fever, some headache, some chills, some pains, you know, which can be confused with anything, right? So that's sometimes why we have a little bit of a delay in a lot of our diagnoses, because these are viral symptoms early on of a lot of viruses that generally, prior to the COVID era, we didn't necessarily seek medical attention as soon as they started.
Very true. So after vaccination, when is somebody fully protected from monkeypox? after receiving the monkeypox?
That is a good question to review. So if you come in, let's say you come in today and you get your monkeypox vaccine, let's say it's the Jynneos vaccine. It is a 2-dose vaccine, very similar to our Pfizer and COVID vaccines. So it's a 2-dose vaccine. So you come in on day 1, you get the first dose. Then you come back 4 weeks later on day 28 to get the second dose. And then it's 2 weeks after the second dose until you're fully immunized. So from stem to stern, from beginning to end, from A to Z, from alpha to zeta, it's a full 6 weeks. So you still have to make certain that you are very diligent about your environment and your activities for those 6 weeks before you are fully protected. Even after that, I would hope that you would continue to follow really good public health measures in protecting yourself and others from monkeypox.
Do we know how well the monkeypox vaccine protects? So if you do get the 2 doses and it's been 6 weeks, what's the percentage of effectiveness?
And so far, we've seen that the percentage is higher than 92%, which is actually quite good. That's actually very good. And so we continue to encourage people then to get these vaccines.
Are there any populations or group of people who are protected from monkeypox?
Let's review that for just a second. So those people who received the smallpox vaccine have a really good degree of protection from smallpox. So that means anybody born before 1972. And it also means anybody who was in the military from 1991 or earlier. Those people have some degree of protection. In fact, we are postulating a fairly high degree of protection at about 85%.
That's great. That should give some reassurance to certain groups of people that they're at least somewhat protected.
Yes.
Can people who are pregnant or breastfeeding get vaccinated for monkeypox?
They absolutely can. And actually, we don't have a lot of data on it, but we do recommend that people who are pregnant and breastfeeding move forward with getting vaccinated against monkeypox, especially if you're in a high-risk group or you have been exposed and you're in that 1 to 4 day window after a known exposure.
Should somebody get the monkeypox vaccine if they've already been vaccinated for smallpox as well?
So the answer to that is yes. The smallpox vaccine is at 85%. We know the monkeypox vaccine can take you up much higher. And so we want you always to have the highest degree of protection possible.
And it's okay to have both, have had the smallpox vaccine and then later have the monkeypox vaccine.
It is okay. We have not seen any studies that are discouraging you from getting both of those vaccines. And indeed, many people are unaware of their smallpox vaccination status.
That's probably very true. Like you said, the military gave a lot of shots and not everyone was aware of what shots that they got and when they changed what shots they received. So
especially the military where they're trained to not ask any questions.
Right. And I didn't know that 1991 was the cutoff for when smallpox was still being given. So that's very interesting. Can someone get monkeypox from the vaccine?
So you cannot get, first of all, that's also another good question. We've had that question a lot with COVID as well. You cannot get monkeypox from the vaccine. So there is no risk of getting monkeypox just by getting the vaccine. So I want to be clear about that. And some people have said, I'm going to avoid that because I don't want to have the risk of getting it. I'll just take my risk out in public, but there is no risk of getting monkeypox with the vaccine.
And we did say this, but I think repetition is a good thing. So can this vaccine be given at the same time as other vaccines?
Absolutely. So let's go over that. you can get the monkeypox. Do not delay. Let me put it this way. Do not delay getting the monkeypox vaccine because now you're catching up on some of your other vaccines. And don't delay getting your other vaccines like flu or shingles or whatever other vaccines you need because you've just gotten the monkeypox vaccine. We want you to move forward with all vaccines. We know many people delayed medical care during the height of this COVID pandemic, and it's been 2.5 years. And not just medical care with vaccines, other medical care for really good primary prevention and healthcare. So we want to encourage everyone to move forward with your healthcare independent of your monkeypox vaccine status. And that includes all vaccines with the exception of the COVID vaccine. And that is not an absolute exception. That is a have a conversation with your doctor first exception.
Very good. Is there anyone who should avoid getting the monkeypox vaccine?
You know, there are a very small number of people who should avoid it. And that's mostly people who have allergic reactions to the components of the vaccine. So if you're allergic to something called ciprofloxacin or gentamicin, or even some egg products, then talk with your doctor before moving forward with getting the monkeypox vaccine. This is a very, very small number of people. It almost will impact no one, but there you have it. That's the answer.
Okay. So, Dr. Morgan, if you could impact one myth that you've seen on social media or seen repeated out there, something that you would like to correct so that people have the right information, what would that myth be?
And so that myth would be in the HIV population, HIV population that's taking PrEP therapy. And so the myth is, if you are an HIV patient and you're taking PrEP therapy, then somehow you are protected from monkeypox, but you are not. It's somehow, if your T cell count is high and you're on PrEP therapy, then you will not get monkeypox. That is not true. And in fact, 40 to 50% of monkeypox cases in the United States are in this HIV population. And I think that largely it is being driven by this myth that you are protected with the PrEP therapy. Remember, that protection is for HIV. The same as the varicella and shingles shot is for the herpes family of virus. The same as the COVID home tests are just for COVID and not for monkeypox. So that therapy is really for HIV. It confers zero protection against monkeypox. And because of this misnomer, we see 40 to 50% of monkeypox cases in the HIV population who thought they were protected because of their PrEP therapy. And so if that's one myth or misnomer, a good thought though, I want to say that is a good thought, but it's not true.
Good to know and very good information to share. So thank you, Dr. Morgan. We really appreciate you joining and giving us this educational webinar. For additional information, you can follow Dr. Morgan on social media. Her contact information on these channels will be provided in the video description below. And thanks for joining us tonight.
Thank you. I appreciate it.